Your health matters.
And Kintegra is bringing care straight to our community.
Welcome to Keys to Home. I'm Brandie Bruner, and I'm here today with Kintegra Health. Thank you for being our guest. Please introduce yourselves and let us know your roles in Kintegra's medical field.
Absolutely. Good afternoon. My name is Emily Speece. I'm the AVP of Medical Operations for Kintegra Health.
Good afternoon. My name is Viviana Faxon. I'm the office manager at Kintegra Family Medicine, Statesville.
And I'm Amanda Phillips. I'm the practice manager at Kintegra Pediatric Medicine here in Statesville.
I am so happy and honored to have you as our guest today. Kintegra, you have been consistently a part of SHA's and ISCEC's South Statesville community development. And your value that has been added to our community is just immeasurable.
Thank you.
Oh, thank you.
Thank you.
You're welcome. And as we all know, health is wealth. Your commitment to serve in South Statesville has put more power in the hands of the communities that you serve.
Thank you.
Thank you. Yep.
For the people who may not know Kintegra yet, how would you describe your mission and the community that you serve?
Absolutely. So Kintegra Health is a community-sponsored, family-centered provider of health care. We provide health education and preventative care services without regard for the ability to pay. So what that means is folks who are uninsured or underinsured, we're not going to turn those folks away. Mm-hmm. Those folks who have insurance, maybe not able to pay their copay, again, we're not going to turn those folks away. We're going to see them, treat them as we would any human being. A little bit about our population that we serve in the community. We provide services to pediatrics all the way to geriatrics. So we have our family medicine pediatric clinic. We also have behavioral health clinics, psychiatry clinics, dental, as well as some specialty services such as optometry, podiatry, and
Chiropractic.
Thank you.
Yes.
Thank you.
There's a lot going on.
That was a mouthful. So tell me this, and I'm sure everyone is interested to know, what makes Kintegra's approach to community health different from a traditional clinic or doctor's office?
That is a great question. So what's different between Kintegra and a traditional clinic? Well, we basically offer integrated care. So we provide medical for our pediatric adults, as well as an integrated model of behavioral health providers that are located in each primary clinic. Some of our clinics, including dental, are in some of our locations, for instance, pediatrics. We have pharmacy and chiropractic clinic at our Shelton Avenue where Viviana's at.
Viviana.
Yes. So at Kintegra Family Medicine on Shelton Avenue, we have pharmacy, chiropractics, or pharmacy. It is a 340B. Or pharmacy gets medications at the lower cost. So that's a benefit for our patients. That means that a medication that might be a higher cost in a retail pharmacy, or patients are going to get that in our pharmacy for the lowest cost. I think that's very beneficial because, patients a lot of times can't afford their medications, but with the lower costs, we are able to assist them to make sure they're taking their diabetes medications, high blood pressure, blood thinners, to make sure they healthcare and their health gets better.
So that's another addition that makes us different at Kintegra. So you can go to see your primary care provider and then go get your pharmacy medications all under one roof. So that's another difference between a traditional.
Oh, wow. That's exciting. Especially with some of the barriers that we have in our community, you make it easy to serve a holistic client. So thank you so much for
We
that.
also, one of the things that kind of sets us apart is our sliding scale. So if people are uninsured, we can base what their copays and stuff are off of income that they actually bring in. So that's a very big thing that helps a lot of our community. Kids, I work in pediatrics. We have some kids that come in that aren't insured. Vivi has them at family medicine as well. So we'll see them. And even if they're not able to pay that copay that is set by the sliding scale fee, we're still going to see them regardless. But that's a good little thing that we have that allows them to have access to healthcare that they might not otherwise have.
Yep. In addition to that, we also have community resource advocates located within our clinics as well, and those folks will help with finding the eligibility and helping them fill out the paperwork for the sliding scale, as well as we have a program that we work directly with. The medication assistance program is what it's called. We work directly with the pharmaceutical companies to get lower cost medications, usually a 90-day supply to those folks. And then they also assist them with the Affordable Care Act enrollment, as well as Medicare enrollment. So,
that's good.
so that's an additional service that we provide.
Awesome.
They also peeping in on that. They also assist with housing, any barriers that the patient express, like food, clothing. So they also help in a different ways towards patients, providing that information if they have lack of transportation. So we do offer transportation tokens through ICATS for patients that have a barrier to come to the clinic to get their medications and go to get groceries. We provide those at no cost.
So a lot of benefits.
Yep.
We see. Oh, wow. And so in today's times, with so many families dealing with stress, trauma, and anxiety, what mental or behavioral health services does Kintegra offer?
Well, that's a great question. So, as I mentioned earlier, we have what's called an integrated model where we place behaviorists, or LCSWs is what we call them, licensed social workers, in the primary care clinic. So, if the patient comes in and they see the medical provider for some medical reasons, but in addition have some symptoms, maybe anxiety, depression, whatever that trauma, family stress, that we're able to bring that LCSW in to see that patient immediately. So they're not having to schedule another appointment to come back in. All those services are seen at that moment. We also have some additional freestanding psychiatry clinics. So if the patient needs medication, we're able to refer those patients over to see Dr. Stacy or Miss Donkwell here in Statesville. And then we're co-partnered with Iredale Psych. So we can also refer to those folks as well.
Excellent, excellent. With both dental and eye care being so important regarding a person's overall health, can you talk to us a little bit more about how Kintegra provides these services for children, adults, and seniors?
Absolutely.
So I'll speak to dental. So the pediatric clinic and the dental clinic are currently at the same location over on Brookdale Drive, close to Ida Memorial Hospital. So the dental team over there is great. They do start giving dental care to kids once they turn a year old. So we have a great program with pediatrics. There's actually somebody at the dental clinic that'll come in and see the kids while they're there, set them up for their appointments, whether they've seen a dentist before or not seen a dentist. The dentist over there will do, fluoride on their teeth, check for any cavities, good cleaning. That first visit is really just to get them comfortable with being at the dentist, which is really nice. It keeps them from being scared when they go later on. And then as they progress in age, obviously needs and things kind of change. So they just meet them kind of where they're at. For the adults, they also do exams, fillings, crowns. They do dentures if needed. If there's anything more in-depth that is needed, they do have other dentists here in the area that they refer to for more in-depth things. Our dentists also go to the hospital and do sedation dentistry. So if our kids or even some adults are not able, to stay calm or still is the big thing with kids. They can't sit still. They will actually perform any kind of crowns, fillings, things like that over at the hospital. So it's a really good clinic over there and a good way to kind of get everything you need in one spot.
Vivi, I'm going to bring you in on this conversation because there is a new pilot that they started where they have cameras in our medical clinics. Can you tell a little bit about that workflow?
So let's say a patient comes in to see a primary care physician and they complain about a toothache and abscess. So we have a special cam that the provider is able to take pictures, real pictures, and we have like a communication team base. They will send the pictures to the dentistry, and the the dentist will check those out and make sure and give suggestions, and will recommend what to prescribe to that patient, and they will go ahead and get the patient scheduled at the dental office. So that's another great service that we have.
Oh, wow. So, okay, let's ask this question. How easy is it to get started?
Very easy. So it's a quick referral process, or not a referral process, but a simple phone call. You would just call the main number for the dental team, and they would get the appointment scheduled for those patients.
Okay.
And then you want to talk about optometry?
I do.
A great thing there as well.
Yep. So optometry is key as part of a patient to make sure that they are getting good vision screenings, as well as, we worry about our diabetic patients because they could have loss of vision if they're not maintaining a good regular eye examination. So we have a optometry service, 2 different routes. The first route is for our patients in clinic. So we have a referral basis. We have a bus that comes out and sees those patients. They go out on the mobile unit. They get their eye exam. We do have an optician who prescribes glasses as well for the patients.
Wow.
So they're able to pick those up as well. The twofold part of that is we're also in the school systems for Iredell Statesville schools. So it's very important for us to do vision screenings in kids in school. So those that have failed their vision screening, or the Kintegra optometry mobile unit goes out and does additional vision checks
Like
on
the
them.
follow-up.
The follow-up, yeah.
Oh, wow.
Yep. So that's an additional service that we provide. At the end of the day, Kintegra's goal is to provide accessible, integrated care for patients of all ages, from infants to seniors. And because of healthy smiles and healthy vision, it's key components of overall health.
For sure.
This is amazing. I'm just honored to be here with you and just gain all of this information. It's one thing to be your property manager, and when you call me, I come and fix a light bulb or check on a leaking roof.
And we because I know several times, we have urgent needs, and she's always willing to help and send somebody as soon as possible.
All of
so I
these-
appreciate that.
Oh, thank you so much, Viviana. And I'm just like, all of these services are right under this roof.
Yes.
Yes. And that's the ultimate goal for Kintegra, to one-stop, the patient has one stop and have all the services for the patient.
And we're always looking to see how we can expand access in the community. So our leaders are looking at different innovative ways. Something new that's coming with optometry that I did not mention is virtual optometry.
Oh, wow.
Yeah, so we'll have an optometrist at one set location, and they're able to utilize certain tools to do the actual workflow or workup on the patient, and then they'll be able to prescribe from any location.
So yeah, we definitely want to circle back to how patients can get connected virtually.
Yeah, so we do offer in-person and virtual visits, most of our services. The main thing to do is just call our centralized scheduling line, and that is 704-874, if y'all can help me.
3316.
Thank you, ma'am. Thank you. Yeah, so that's the main centralized number for all of our locations. You would just reach out, tell them the need that you, the specific medical clinic that you need to schedule with, and then they'll get them set up.
Yeah.
Okay, wow, that's amazing. And I also see that you have the MyChart.
Yes. So MyChart is an additional way for patients to look at their lab results or look into their chart. They can also request appointments through there. They can't schedule through there at this time, but that is coming down the road. But I love it. I use MyChart Access all the time. If I have lab work done, or if the provider's told me, hey, I need you to start this new medication, I can go back to the notes and review those.
I will say too, like pediatric clinic, if you're a parent and you can't get your kid in maybe right at the moment, our providers are constantly checking that MyChart. So that is a great way for a parent to be able to get directly in touch with a provider. It doesn't necessarily go through, a medical assistant or a nurse or something first. It's going directly to your provider for them to then reply back to you. So it's a really good line of communication there that's open all the time.
Absolutely.
Oh, wow, that's great. A direct line of communication that you can trust.
Yes, exactly.
So for our parents and caregivers, particularly those in public housing, what family services should they know about? And I think Viviana did touch upon this about the housing and food assistance. But is there anything else that you would like to add to that? Amanda, Emily, or Viviana?
Yeah. So us, we take care of kids, of all ages. We do see a lot of them that come through, but we also, if there are issues with housing or food, school's getting ready to start back, and that can be, a big barrier or a burden on a child or a family. So when they come in and see the primary care provider, let's say for their physical, there are some screenings and stuff that we do to see if they are worried about certain things. We also are able to give the parent a screener without the child knowing kind of what's on that, so that the parent doesn't have to necessarily discuss, we have a barrier with food, but you don't want to scare your child. So there's a great way for them to fill something out as well. And then our LCSW comes in typically at that appointment in that integrative model, and she'll see the kid, if there's something specific that they're worried about, or she'll talk to the parent by themselves to figure out what resources and stuff we can give them. So, even though we are a pediatrics clinic and we take care of the kids, obviously, with checkups, vaccines, that kind of thing, we're there to take care of the parents and support them in any way that we can as well.
So at Family Medicine, we also offer women care. So we have a provider that comes from Gastonia, and he does colposcopies, EMBs. Once a female get an abnormal pap smear, that's another service that we have integrated in our clinic. Instead of going to a gynecologist, that will help that patient in need as well. We also have a hepatitis C treatment clinic where several patients have been cured for Hep C. So that's an amazing,
over 1,000 have been cured.
So that's an amazing service that we were able and still able to provide to our patients, because those medications are a high cost, and through a pharmaceutical company they get it for free and not cost. So that makes us feel proud, because we're trying to make our community healthier.
Absolutely.
Yes. Awesome. So, and also we know transportation can be a barrier, and we did speak on the virtual access that a patient can have to their chart. And you're also working on patients being able to, hopefully in the future, schedule their own appointments. What options does Kintegra offer for those who need to get to their appointments, but they may not have transportation?
So we do have the transportation tokens. Once the patient or someone expresses a lack of transportation, we can even send them via mail. So they get the transportation tokens. They will contact ICATS, and that will provide them transportation to make sure they come to the clinic for their appointments. Also, on Shelton Avenue, ICATS is a stop as well. If someone comes to the clinic and they say, well, I don't have transportation to go back home, but we can provide those transportations at that moment. The patient will be able to ride the ICATS bus as well.
Yeah, so they go through to any clinic. We give them 2 tokens to and from, to the pharmacy. We even help them if they need to go get food resources or anything like that in the community. We will supply those tokens as well. We have dedicated funding just for that barrier.
That's excellent. And can you please share more with us about the on-site pharmacy?
Yeah. So our on-site pharmacy, it is at 1022 Shelton Avenue. We are open Monday through Friday from 8 to 5, and they do close for lunch from 12:30 to 1:30. The pharmacy is for all patients. And an additional thing, patients that are being referred to other specialties or primary care physicians, they can utilize our pharmacy to get those high-cost medications for a lower cost. So that's an additional resource that we have at our pharmacy. Also, the medications are lower cost. What costs in a retail pharmacy thousands, in our pharmacy will cost pennies. So that's another service for patients to be able to get their medicines and to be able to afford them.
And this too, it can be for patients who are insured, aren't insured, whatever it may be, they're able to use that pharmacy. I was actually talking to Emily earlier. I had a case of a commercially insured patient, and we all think, they have insurance, great, but
right.
high deductibles happen or whatever. And parent was going to ask if we could change child's medication that they were on due to the cost of the medicine at a retail pharmacy. So instead of changing the child's medication, we brought up Kintegra Pharmacy. So the child was able to stay on the same medication and the parent was able to afford what they were on. So, that pharmacy is there for everybody if they're a Kintegra patient. And it drastically helps everybody.
Yes, and I think that's something that the community really needs to know, that you serve everyone. You do have your sliding scale for those who are uninsured or underinsured, but you're there to serve everyone, Could you tell us a little bit more about your chiropractic services or any other services that we haven't covered today?
Absolutely. So we are really trying to expand our specialty services within Kintegra. And just in this location, I mean, it's definitely in all the counties, but just in this location, we just opened up a freestanding chiropractic clinic with Dr. Dobbins there Monday through Friday, 8 to 5. Woohoo! Yay. And she is lovely. If you've not seen her, she does amazing work. And she's got a great personality. She sees folks for back pain, neck pain, joint discomfort, headaches. It's just another alternative way to get relief of pain versus automatically going to like pain medications and things like that. In addition to that, we are providing pediatric services as well. So we do have a pediatrist that comes here every Monday at Shelton Avenue Family Medicine. And she provides services to those that are dealing with any kind of maybe foot discomfort or foot or ankle issues. They manage conditions that affect mobility, comfort, and overall health. So her name is Dr. Jessup. She's wonderful as well. I think she's been with us 2 or 3 years now in Statesville.
Yeah.
And I know chiropractic will see newborn up.
They will.
So we have actually referred some little babies as well.
Oh my goodness.
There's, science and stuff behind it helping with colic, when your baby's just crying 24/7 and you're wanting some relief. We do referrals for that, spit up type issues. And then she'll see, kids too, as they might have a sports injury or something like that, hurting after a back injury or something like that.
Right.
After
practice
then,
or a
what about
game.
pediatry? Does she sees kids as well, right? Or
She does, but yeah, the majority of it's
infant,
adult.
yeah.
But she will see kiddos for sure.
yeah. So
It has just been amazing for me because I am from South Statesville, just to see the developments that's coming and the developments that have been serving for over, 2 decades, as you have Kintegra. And so it's just amazing to see those things in walking distance.
Yes.
From where I grew up. So in regard to your preventative care, how do you approach preventative care for your patients?
So preventative care, I feel like, is where it all starts. If we can get you in there preventative, it's better for us to prevent you from getting, disease than it is for us to try to treat it later down the road.
Absolutely.
Well said.
So for kids, for us, they're coming in for a wellness visit from the time they're born all the way through 18 is what we see. We see them pretty frequently within those first 6 months of life. We're making sure we're developing right, we're eating good, we're gaining weight properly, immunizations, that we need to prevent illnesses and that kind of thing they're getting at those times. And then we do continue to see them all the way through. But, it's easier for us if we can catch, maybe a developmental delay or even a growth delay, a speech delay, something like that earlier on than later, just so that we can help them as much as we possibly can. And then we also do those screeners for those older kids and the parents when they come in for well checkups to make sure we're not depressed, we're not having anxiety over something. There are no barriers in the home that may prevent that child from flourishing the best that they can. And then Vivi, you can talk a little bit about the adult side.
Yeah, that's pretty well said. For adult care, it will be ideally if everyone will get a primary care physician and get screened, because a lot of times patients come when they're already sick. without knowing the Kintegra is here to take care of their health. Mm-hmm. They do provide service. I mean, a lot of times we hear stories in backgrounds for patients. I haven't been in a doctor for so many years because I'm afraid that I'm going to be turned away because I don't have a way to pay for my medications and different things. So we share that, we are here to make sure your health gets better. We are here to take care of you and to provide the medications and the service that this patient needs to make sure their health gets better and they are able to function.
Yep.
We do see a lot of senior citizens that comes to see our providers. Mm-hmm. We are here to help. A lot of times we help them setting up home health to make sure they get assistance with the activity of daily livings. Simple things like just taking the patient to the store to get their groceries, helping them with laundry, bathing, getting their medications ready. So that's another service that our providers would refer patients to home health to alleviate that barrier for senior citizens as well.
Absolutely. Thank you for that, Viviana. So if we have people in the audience right now, someone who doesn't have insurance or is worried about the cost, can you go into it a little bit more detail about how Kintegra helps the uninsured and underinsured receive care?
Yes, absolutely. So as we have mentioned prior, we believe everyone deserves access to quality health care, whether they have insurance or not. So we're going to serve those folks irregardless. We do accept all insurances, but those that are underinsured, who maybe have high deductibles, as Amanda mentioned earlier, or are uninsured, we base it off a sliding scale fee. We try to help them get the application completed, and it's based on family income or family members and household income. So once we take that into consideration and see where they fall under the federal poverty level, then they may end up, say they're covered 100%. They may be requested to pay a $30 copay, and that would cover all their services for the visit as well as labs and so forth. Now, if they say, "Hey, I can't pay this $30 copay," that's
Right.
okay. We're not going to not see you. You're going to continue to be seen and treated just as we would if you had insurance or a copay. So that's the main focus. We want folks to remember that we're going to see you irregardless the ability to pay.
Yes. So, and I think that sometimes that it keeps people from coming in the door.
It does. They get worried. They think financial burden, or I'm going to create an additional cost that I can't afford. So they need to alleviate that from their minds.
Embarrassment.
Right. And just focus on calling, schedule an appointment. We'll get them in there, get them treated, get them to the pharmacy. So for our uninsured folks, we have dedicated funding for those folks. If they say, "Hey, I can't afford this $5 copay for my medication," don't worry, we have some funding that we'll utilize towards covering the cost. So
That's really good. So does Kintegra have partnerships with other organizations that help support your mission? Because you're big, you're so huge.
we have tons of partnerships. For instance, I had mentioned ISCEC. That was our first partnership with Iredell Health Systems, and then we expanded to Iredell Pediatrics. We hope that partnership continues to expand, as well as we're in the health department. We have a LCSW there 1 day a week. We have a LCSW at Mitchell Community College. And we're in Iredell Statesville School Systems with our mobile units for dental, optometry. So however we can support and provide access to our folks in the community, Kintegra's there.
Awesome. So thank you for that again, Emily. And whoever would like to chime in on this question, please feel free to do so. Just want to ask, what impact do you hope this program has on the community in the future, 5 or 10 years from now?
Well, our goal is we hope to see the community healthier, those individuals and stronger families, a stronger community, because more people have access, they receive care, you're going to have a healthier community. So that would be our goal.
For sure.
Health is wealth.
Yes.
There's more than one type of currency.
That's right.
All right. And so we do know healthcare can feel intimidating. You may have, aching gums, your teeth might hurt, you may have undiagnosed symptoms, and they could be physical, they could be mental. How does Kintegra build trust with folks who may have that negative experience in the past with, receiving medical care or being turned down because of income?
Yeah. So, I mean, we're all here to help people. Kintegra as a whole is very much around helping. Everybody that works here, I will think you will see buys into the mission very much. We are here because we want to help. So I think when people come in and see a smiling face or somebody who actually listens and you can tell they care, that can go a long way. You're not rushed through as a number. We are going to take care of you whether you can pay or not. That's what we're here to do. With kids, some of them have maybe had bad things happen at other offices as far as, we don't like giving shots and that kind of thing, but we try to calm the kids, calm the parents, let them know, things are gonna be okay. We're here to help you as much as we possibly can. And I know Vivian and them do that the same type thing at family
I think
as well.
it's important building the relationships with the patient, like, saying a good morning, good afternoon, treating everybody with kindness and respect. Yes. Because you never know what that patient is being through before they close the doors, and maybe that might be the only kindness that they receive. Ensuring that we are here to provide excellent service, to meet their needs, to help them, and to try to give them the guidance and the ways for them to succeed and to feel better, to take care better of themselves and to improve their health.
Absolutely.
Okay, and does anyone have an example that they would like to share about where Kintegra services really made a difference in an individual or family?
So the one I shared earlier about the pharmacy, was a big thing. Just, I think, seeing the relief on that parent's face of knowing that my child's not going to have to change a medication that is working for them, and now I can also afford it. That's a big thing. We also know, and I'm sure Vivi has experienced this as well, whenever our community resource advocates, or CRAW is what we call them, is able to help somebody sign up for Medicaid who may be uninsured, that's a burden off of them of not having to worry about that. Or when our sliding scales allow somebody to come in and be seen and not have to worry about not having insurance or not having a way to pay. We see stories on a regular basis of just how our mission is truly helping this community.
And it is. In addition to the transportation barrier that we mentioned earlier, what other common barriers do you see for families like those in public housing communities, and how does Kintegra Health help remove those barriers?
I think some barriers that we would focus in on are the lack of insurance, the concerns about the cost, limited access to specialty care, which we are trying to expand those services for our folks. Difficulty navigating between healthcare system. It's very confusing for folks who are not familiar with the healthcare services out there. So one thing is we have like a high population of Hispanic patients, and so we make sure that we have a translator there. We actually have what's called Proprio. It's a resource that we click on whatever language it is, and it brings a live person on board, and they're able to translate through that whole visit. So that eliminates that barrier. Of course, the challenges related to food, housing, and so forth, but we do have those dedicated folks who are able to support our patients as they come through. So those are some factors that make it difficult.
Okay, and what's one thing you wish people who may not be seeing a healthcare provider right now, what's one thing you wish they understood about their health and the resources available to them?
I think just that we're here to help regardless. Don't be scared to walk in the door for any reason. Embarrassment of not being able to pay, or I haven't been to the doctor in 10 years and I don't know what might be going on. We're here to help regardless, with no judgment. Treat you like family when you come in.
So, and I would just love to repeat that Kintegra Health is here to help. Like I said earlier, the value that you add to the communities you serve is immeasurable.
Thank you. We appreciate that.
Yeah.
And so we do want to ask about any upcoming events or opportunities that you would like people to know about.
Absolutely. So we just finished the Iredell Back to School Bash at West Iredell High School this past weekend. We saw 1,003 kids. It was fantastic.
awesome.
Yeah, it was amazing.
The
It's always a fun
kiddos in
time.
this community were able to receive backpack, school supplies, a brand new pair of tennis shoes, socks. We also gave out little bento boxes, and we educated them on, portion control and stuff. We just had an amazing time. So that was one event we just had. In addition, we have the upcoming event. It is the Community Health and Wellness Fair on Saturday, August the 22nd from 10 to 2. We'll be attending that. And, of course, the Levitt AMP music series coming up.
Kicking back off September the 12th, Saturday, September the 12th at the Statesville campus located at 110 West Allison Street. Where can people learn more about Kintegra Health, find locations, and get involved?
Yep. So easiest way is our website, kintegra.org. Go on there. You can find just about anything or locations that you need. We're also on social media, so do that. And we have multiple locations here. Vivi's on Shelton Avenue. We're on Brookdale Drive. And then our behavioral health clinic is in the Fern Creek area. So pop in anytime. We're all happy to help you, even if you might not need our services at our facility. We'll get you to where you need to go.
Absolutely.
Perfect. So you're located some landmarks. I know you're right there on Shelton Avenue besides Skinner Seafood to Go.
That's right.
And across from Pfeiffer's Chicken.
Yes.
Base Car Audio. So you're right there, very conveniently located. And also the
Brookdale Drive. So we're across the street and down a little ways from Iredell Memorial Hospital. So
Correct. And that's the DMV area?
Yep. DMV's close to us, and dental is also in that same building. So pediatrics and dental are both in that location.
And also our Kintegra Behavioral Health Clinic with the psychiatrist that are at 1450 Fern Creek Road, so not too far from other locations.
Yep. You can meet all of us in about 5 minutes from each
Yep.
other. So we're all close.
You see? So I just want to say thank you for joining us today for great and all the great work that you do and for sharing this great information. We will be sure to share your contact information in the notes below.
Wonderful. Thank you for
Thank
having
you.
us.
Yeah, appreciate it.
And thank you all for watching Keys to Home. Be sure to follow SHA on YouTube, Facebook, and Instagram to keep up with us and continue to share news and resources you can use. Be sure to like, share, and subscribe.
Thank you.
Thank you.
Bye.
Bye.